able to pick as many of the roles as were appropriate for their community. So you can kind of just get a picture of some of the people who are currently responsible for developing family-driven practices across the country. And I'll also say that there were 53 people who answered the survey, or who were actually on the line participating via the internet, who were able to participate in the survey, and they were the family contacts and project directors and EDs from family organizations, community partners. They were a wide range. So saying that, I'm wondering if anyone has any questions about this so far. Okay. All right, you're off the hook this time, but not for long.
Hi, everybody. This is Sandra Spencer, and I'm going to get our conversation started. So when we did the poll and we asked everyone what was most important, the number one answer was getting buy-in. And the buy-in was coming from several different people, as you saw, from system leaders, providers, family organization leaders, and families. So the first question we want to ask is, why is buy-in necessary? And we know that having family-driven practices is one of the core values within systems of care practices and implementation. So why is it you think that we talk about getting buy-in, and why is that important? So I'm going to pause and see if we got any comments from you guys on the phone. And this is a conversation.
Okay, so why should people in systems of care buy into this?
Marie, this is Joy in Mississippi. I was just going to say, and I kind of have seen this with two different hats on, because I started in system of care work as a provider and then later on became a family member. But I would say as a provider, and I've been a project director, I'd like to say it's important to do the right thing to do, but even more, another thing that affected me as a provider is the services were so much more effective when they were actually family driven, and I think that's something we don't think about. Well, at least I hadn't thought a whole lot about until I actually saw it happen.
Right, absolutely. That's a good point, and I think we think about it in terms of buy-in. I think the services become more effective because families are able to say clearly what works and what doesn't work, so that what they're getting is exactly what they need as families. Anybody else can give us any idea why you think buy-in is important from all of these levels we mentioned, from service providers, from families, from all of those folks? Why is the buy-in to this principle that we need to be family-driven? Why is that important?
This is Deruta Jones from Parent Watch. I have an idea about that.
Okay.
Well, when you have buy-in from all of the different participants, actors, basically that it disperses the responsibility and makes everyone feel as if they have a stake in the operation of the programming.
Right, absolutely. I totally agree with that. Anyone else? So we have on here, what is needed for buy-in to occur? Because, you know, one of the things that I have found in my years of working with funded systems of care communities is the people who write these applications for you all to get funded are usually not the same people who are then charged with implementing the grants or the cooperative agreements around systems of care. So I think you have to start right away, making sure that, when the team is put together, that they have buy-in. So what do you need to do right at the beginning? When you get your funding, when you start your meeting, what is needed in order for buy-in to occur? Or have you all experienced everybody was already on board and ready to do this? Is that the experience?
Deruta Jones again. I have a response.
Great.
Well, effective communication is the key right here. Once
Yeah.
the organizations, individuals come together, everyone has to be communicated with effectively about what the buy-in actually entails, what they will receive through the buy-in, and what they are expected to offer through the buy-in process.
Absolutely. We used to do we had a saying around this when we were starting our system of care in North Carolina many, many years ago, is that we have to make sure when we start talking about system of care principles and having family-driven practices, we said make sure you don't overpromise and underdeliver. Because sometimes when we start talking about our conversation and we say, systems of care need to be family-driven, where everybody hears that much differently. So some people get the vision that everybody gets on the bus and the families drive. They decide where to go, when to go, how to go. And the family-driven principle is not that families are dictating everything. And sometimes you have to make sure that providers don't get that impression and then start, trying to hold on to some of the control. But also you don't want families to get that impression because for one or two reasons they can think, well, I can't drive the system because I'm in such need of support. Or families think that I can ask for any and everything I want and I'll get it. So I think you're so right. You have to do effective communication, have transparency so that you're not overpromising or everybody kind of gets on the same page. Uh, Anybody else have experience around that? What happens if you don't effectively communicate? Or what happened as a result of effectively communicating? We have a quiet bunch.
Okay, well,
Hi,
this is
hi, this
Marie,
is,
and oh, go ahead.
this is Kay Barkin, and with Hand in Hand in Fort Worth, and going to a slightly different aspect, I think, of what's needed. I think it's really helpful if there are family members there from the very first meeting,
Yeah.
because otherwise it seems like we've had to struggle getting past the idea that this is a provider organization only, and I've actually, in some of our rural counties, heard people say this is where we get away from our families.
Yeah. You're absolutely right. I know it's really bad when you come to a game that's already in progress and you come to a table where people are already working together and then you have to find your place. And so that is one of the things we talk about, is that from the very beginning. And to me, the beginning goes back to even writing the proposal to get funding. Having family engaged at the very beginning of that. And then once the award is gotten, then in all of the planning and all of the everything, having families at the beginning. Because you're absolutely right, it's very hard to then play catch up. Any other comments around that? That was a good point.
This is Marie, and I was going to add mutual respect, so that everyone in the community, provider, family members, systems worker, they respect one another and what it is that each is bringing to the table. Okay, we'll go on to the next question.
How has family participation in systems work gained acceptance in the system of care that you're representing on the phone? So you guys are on the call, and you know that a part of your mandate is to make sure that you have family participation in systems of care work. How has that gained acceptance? Can someone give us some examples of how that has happened in your community, or your statewide expansion, or your statewide planning initiative? Well, have you guys felt like that you've done acceptance with the notion of family engagement? Do you feel like that's happening?
Well, our organization, this is DeRuta Jones with Parent Watch. Our organization started with that as its primary goal, was to empower and to empower families to handle and to negotiate different bureaucratic barriers in underserved communities. So we've had a lot of luck with family participation in that respect.
So is there anywhere where that's written as maybe a policy or a, how did you get that from the beginning?
The founder was dedicated to it and made sure that it went into every single executive summary and every single proposal ever written.
Wow, great. That's a good example. So before the proposals even went in, that was an expectation and it was written.
That's correct. And we have had family members on our board.
Excellent. What about others?
We've had family.
Go ahead.
I meant to say we've had representatives from the community's need actually on the board helping with decision making.
Exactly. So are there any other folks who can tell us how you gain acceptance for family participation?
I really like everything he just said, and Sandra, what you said earlier about the people who write the proposals or the RFPs don't necessarily, or where this initially starts, those people don't necessarily know about family-driven care, and I wish that they did, and that all initial funding could be more like what he was describing, where it was a requirement to get the funding, to have all those, to have family members be involved in proposals and how they would, and you'd have to say how they would be involved in oversight bodies and all that, but I do think that is something that we can do locally. And I also think it's important for it to be part of evaluation of projects, yes, and to have that set up from the get-go, and for family members to be involved in doing the evaluation, especially in asking other families if they're truly satisfied with services and if their children are getting what those families want for them.
Oh, I absolutely agree. One of the things around accountability, I think that when you're writing the RFPs, the request for proposals, if you put it in and get funded to do it, then it's a better chance that as you get your technical assistance and as you get monitored by the government, that you will be held accountable. And so I think it's so important that families are involved in the proposals and all of that kind of information. Anyone else on gaining acceptance? Because we're going to move on to some other areas of this. So what have you done to promote family participation? And we know that when we looked at the registration for this information exchange, there were several family members on here, but we also know that there are project directors on this call, there are administrators, there are people who work for different agencies. And one of the things that we saw in our poll when we started this call was people gave responsibility to several stakeholders. Some of them said it was the Key Families Contacts job. Some said it was the executive director of a family-run organization. And several of you said it was the project director or principal investigator. Several of you said that it was for community partners. So whatever role you play right now in your community, what have you done to promote family participation? I'd like to hear several of you give us an example of some things that you've done to promote family participation. And we're going to capture this.
There's no wrong answer. We're having the call to hear from each other. Everybody can learn from each other.
One thing that I think we've had to do in Fort Worth is at a very early stage train the family members on how to be a part of the systemic area, how to show respect for the providers. If they have a chip on their shoulders, that's not going to be accepted very well.
Mm-hmm.
And then people get turned off and they don't want to hear from any families. So I think also selecting family members who, I'm trying to think of the best way to put this, but who basically in their speech, in their attitude, and in their suggestions show respect for everyone in the system, other families, providers, managers, everyone.
Right. You know,
Totally agree, Fort Worth. But the way that we've handled it in Washington is we engage actively in parent training. Mm-hmm. So we have to train parents to represent themselves and to advocate for themselves and for their families, so that they can do that, so they can actually go in and penetrate and help to reform the systems of care through respect and through good mediation skills and so forth. I did want to return to one thing that you had on the slide early, one of the earlier slides that I've been thinking about. I needed to mention to you is that in terms of bringing in family participation in the proposal writing stage,
mm-hmm.
we need to improve that area with our organization. In the actual practical, our practical experience has been that sometimes the stresses of getting a proposal generated with very limited resources means that we return to professionalism. We professionalize the proposal preparation process, and we will already have had the family component developed because it was emphasized on the leadership level of the organization, but we may not necessarily always have the families contributing to proposals per se. We will look into changing that process to be more inclusive.
Absolutely, great. And this is why we're doing this, because I think we all can learn from each other. And it looks like a trend that I'm hearing right now is about parent training and having families ready. One of the things that we know with family engagement is that when we want to all sit around the table to plan, implement, and evaluate systems of care, we have to make sure that everybody around the table does that, mutual respect. And I think it's important to never ask families to do anything that we haven't properly trained, prepped, and prepared them for. And I think it was to the other point around, families respecting providers in the room and vice versa, providers respecting families. And one of the things that we should look out for is when we ask families to be engaged and to sit at these different tables on different levels, that we make sure that the families, number one, are not in the middle of the crisis with their children. And I don't think systems remember to do that sometimes. So if your main thing is getting your kid back in school, on the right treatment, stabilized, when you go to a meeting, that's going to be the perspective in which you bring. So I would say help families participate when they're better able to participate. Another training that helps families is how to see things from a systems level. And so it's families doing meetings, and they can even share their stories and their perspective. but help families extract what about my story and what about what happens to me and my family can serve as a way to inform and improve the system. And so we train families of how to participate from that perspective. Then I think it won't always come from that personal place, or whether that personal place is a place of pain or disappointment, or whether that personal space is where, getting my needs met. So I think that's one way to promote family participation, is making sure families are ready to participate. Because if meetings go wrong, then I think the tendency is then to say, that's why we don't have families participating. So I think that's a great point, and I'm glad that we were able to capture that. So what else have you done, those of you on the phone? Have you done other things to promote family participation? Well, one of the things that we talk about is how do you move forward in that? And on the next question, we asked the question, if you have a champion in your community, in your system of care, that really is the person who always at your meetings say, do we have families at the table? Have we had families involved in this decision? Families are participating on every committee. That person will be a champion. So do you all have champions in your system of care? And if you do have champions, how did that happen? How were you able to get those champions and use them? Can you talk to us about who those champions are in your systems of care?
Well, our champions are sometimes not always members of the community, but are members of but are providers of care who happen to be very far-sighted individuals who are very helpful and acted as mentors to our organization. As far as reaching out to champions in the community, we did it through community outreach. One of the things that Parent Watch was involved with was when Washington was going through a crisis of gang violence, was we would call for calls for action. We would mobilize community members to demand that the problems be addressed more vigorously. And as people came forth from the system of care to help, and champions came forth from the community to participate, we identified them and utilized them as resources, and they us.
Great. Well, I'm going to ask another question, because I know there are several of you on the call today, and people are a little bit shy about jumping in. So this is kind of how I think it happens in communities, and I think it's a teachable moment, because we know that one of the greatest need that we have, when we did our information exchange from all of the system of care grantees, and we asked people to identify for us what their greatest TA needs were, what they were most struggling with in their communities. Of course, sustainability and funding was one of the things at the top. But right there, and always in the top 5 answers from every system of care funded community and expansion grant, it was engaging families. And so we do realize that that's an issue, and we know that we did on our webinar last week that continuum of how do you go from family involvement to engagement to driven. So we know for a fact that the language and the rhetoric says that systems of care must be consumer and family driven. We know that our mental health care system has to be, and we know that's a principle. But we also know from what we've gotten from you all that this is not occurring in your communities, and that not only is it been an area of need for family members and key family contacts, but project directors, community leaders, people in your collaborative are saying we just can't get to family driven. We have a few families here, a few families there. So what is your greatest need, and how do we have the conversation? And I really want to just pull and engage those of you on the phone so that we can learn from each other. So what is it that's really stopping this buy-in and everybody from saying, yes, family engagement and family-driven care is the way to go, and we all need to do it? So can I hear from some other folks on the call to see, we know it's an issue, so what do we need to do about it?
This is Fort Worth again. One of the issues that we have run into is more from the parent side. We are an early childhood system of care, and it seems like our family members have a lot of crises. It was mentioned earlier that we cannot involve them, but we have had families get very, very involved and very well respected, and then they just almost disappear. We cannot find them anymore. That's one of the issues that we're running into, and I think it happens with everyone, but especially with early childhood, where they're dealing with a very young child and other children in the household.
Absolutely. Does anyone else have some solutions for her before I jump in? Because I know that does happen. Families come in and out of being involved based upon the fact whether their children are in crisis or even their family, you know, with jobs and, you know, meeting all the requirements. Does anybody else have any solutions or ways that they have dealt with this in this community?
This is Marie, and one of the ways that I've seen in my TA work that this barrier is overcome is by always having more than one family member on any committee or in any work, and then also having backup for that family member. So maybe you need 2 family members to work with 2 providers on a project. So make sure you have 3 family members, one that doesn't have to attend every single time, but one who can jump in and help when a child goes into crisis, because that could really happen to anybody. And it's kind of another part of it is when family members are compensated for the work that they're doing, just like providers are compensated, that can help overcome a barrier too, because if a family member, maybe the child is not in crisis, but maybe the family is in crisis because the person, one of the parents or both of the parents are unemployed or whatever. So, so that's something also to think about.
You know, another idea too is really using a peer support model and making sure that there's someone who's walking with this family and being able to point them to other resources when crises occur, making sure that somebody's keeping up with what's going on, and a lot of times that's the role of a peer more so than it is of an agency or a provider group. And the other thing is finding, if you're an early childhood system of care, I still think you could benefit from parents whose children are older and no longer in that age group. So there should be family organizations, family-run organizations within your community where you can find families whose maybe children are older now and they have more time, or you know, the kids have more stabilized, and they may not be the one who, the families who are currently receiving care, but they certainly can add a family voice, they certainly can participate on committees, and they certainly can be the ones who provide that peer support. So that way you have families who are currently receiving support on your committees and involved in your work, parents who've been there and done that and can leave their experience as well so that they're not the ones who will be in and out because of crises. So I think you can use that array of family leaders and family members that way that you always have folks who can participate. Was that helpful at all?
Well, in the early childhood site, we have had trouble finding people who can even start participating, much less several people who can fill one role. Again, it seems to be the nature of what the families are going through. It's not for lack of trying. We have trained several as family partners through our state. Only one of those is still active. So it's been a struggle for us. It's something we're still trying to solve.
Oh, well, one of the other things to suggest, and this goes for anyone on the call, with the Technical Assistance TA Network, we have different levels of providing technical assistance. And so, these learning exchanges and webinars and all of these things come under our generalized TA, but then there is targeted TA. And so Maria and I have many, many years of offering technical assistance to funded communities, and we've done a lot of work over the years with some early childhood communities. And so if you need more targeted TA around that, you can contact the Technical Assistance Network, because I remember clearly working with some early childhood sites. One was in California and other places, and that was, I hear you, because that was the same issues that they identified, because not only that the children were young, but these were also young parents. And so it was more of a challenge, and so we had to really do some very targeted, deliberate technical assistance around getting the families initially engaged and then keeping them engaged. So I would encourage you to reach out for that type of TA, because what you're saying is not uncommon, and some of the other early childhood sites have dealt with it, and some of them have figured out some really good ways to deal with that.
I'm going to go back to the original question. This is Marie, and talk about a champion. When I was living and working in Massachusetts, I was the ED of a family organization there, and it was funded by the Department of Mental Health, and the children's mental health director in that area, she would talk to me in my supervision about things that she wanted to be able, that she was not able to say because of her role and so forth, that she wanted, she would encourage me in that way. So she was a champion for family involvement, and she worked with me to help me to speak up to providers. She gave me that backing. And so when I would speak up at a meeting or so forth, she would back me up. She might not be able to bring up the topic, but she would back me up. So that's one example of a champion. And I don't know if anyone has any others, but maybe we need to move along.
So what do system leaders do to show they are champions? And Marie just gave a really good example from Massachusetts. Does anyone have another example of something that a champion did in your community that really pushed family participation forward? Well, I'll give you an example to see if this sparks anybody's memory. And this one didn't have as good of an outcome. But one of the things that I found out in some of my work, I was my son was served in a system of care in the first round of system of care that were ever funded by SAMHSA and it was funded in about 1990 to 94, somewhere along in there. And there was a champion for families who worked at the state level. And she really bought into the fact that we had to have family voice at every table, family involvement on every committee. She went so far as to one day we had a community collaborative within our system of care site, and all of the community partners, agency partners, administrators were around the table, and there were no family members at the meeting. And so this state leader, who was one of the PIs on this grant, said, asked where the family members were, and the response was that we invited a family member, but a crisis came up. And this state director said that we could not have that meeting because there was not a family member in the room. So the meeting was rescheduled, and the lesson learned was that, first of all, you shouldn't have had one family member, and that we would not move forward with this kind of a planning meeting without families present. So this kind of thing continued to happen, but because there was not enough buy-in from some of her level supervisors, this particular champion was reprimanded for that kind of action. And so the families really had to then rally behind a provider to say that this was really important, until the point where we actually were able to write within some of our policies around community collaborative meetings that we had to have families present at the meeting, and we had to prepare and prep and make sure that not only families were ready, but that all of the providers were ready to engage with the families once they came to the table. So that's just an example of sometimes I think champions take a risk when there is not total buy-in in the community. So we're going to move on from champions if nobody else has anything around a story about a champion. So we're looking at providers as well, and I'm going to clump a couple of these together because we really want to talk about what does it take to show buy-in. If you went to a meeting in your system of care community and you walked out of that meeting saying, wow, they really did buy into family engagement, what would that look like? So looking at this, it's not just providers, but what would it look like if there was buy-in for family participation? So those of you on the phone, if it was really working, what would it look like? So let me give you a question to see if I can get just a couple of one-word answers. If there was a meeting and there were 25 people in the room and they were from several different child-serving agencies, they were from community partners, representatives were there from administrative offices, what would it look like if we knew in that meeting that there was family participation? Would it look like would there be one family member in the room? Would each of these agencies be responsible for each? What if each agency brought a family member? So if there were 12 agencies, there were 12 family members. Can I get a response to that from anyone? Would that look to you like there was buy-in for family participation?
I'd say it would look very much like there was buy-in. A good example would be if at such a meeting, if you had the family members offering input, and it was recorded and taken down and developed into policy, prescriptions. That would be a good example of where family participation was actually happening in such a meeting. What was actually happening and being recognized and respected.
Absolutely. Does anybody have an example of a meeting they went to where family members brought forth an idea, and that idea was written down, taken into account, and actually implemented within that system of care?
I think we have in Fort Worth, despite all our problems. I mean, one of our problems has been trying to get this buy-in, because anytime they need a family member, they go to our system of care organization and the 200 or so families we're providing wraparound for. What we're beginning to see is that several of our agencies have their own family councils, family advisory boards. But we had a long-range planning session, and families were specifically there. And in fact, we have, as one of our platforms on our long-range plan now, engagement of families. But their ideas were definitely incorporated immediately. But we had to give them special invitations and really find ways to get them there.
Good. On one of our webinars, I gave an example of a community that families went to the meeting, and family members said, we are really having a hard time finding an after-school program for our children because, you know, they're not doing well in some of these after-school daycares or some of the more programs that have less restrictive environments, like the Boys and Girls Clubs and recreational facilities that do after-school programs. And so the families asked the system of care if they could get together and figure out a way to either support some of these other programs so that these kids could go, or to create some other kind of after-school or summer program for the children who seem to have some, you know, serious emotional disturbances. And so the families continued to take that need to the system of care and said, this is what families say they want, this is what families say they need. So the system of care community group decided that they would do a couple of things to meet that need. And this particular system of care had a university partner. And they worked with the university partners to get students who were in recreational therapy, music therapy, arts therapy, students who were needed internship placements, who were psychology students, and so forth, to work with recreation, Parks and Recreation, Boys and Girls Clubs of America, and one of the YMCAs in the community, so that they could go in and do some work with those organizations to provide some recreation and different activities for kids who were in the system of care who were attending those after-school programs. Therefore, they could help with behavior management, they could help the students, and they did it for all the students who were in those programs, which really helped the programs, but they also provided that support and assistance so that somebody with more significant behavior issues could still function and have some therapeutic intervention. So the university provided supervision, and the students got to get their hours for internships and some of their other practicum hours that they needed to complete their graduation requirement. So that was an example of families being at a meeting, and the community collaborative wanted family engagement, but realized that families won't stay engaged if we continue to ask for things and the community doesn't comply. So I think that that's an example of where they were able to meet the needs of the family. The university was a community group, so I think that the university got their needs met because they were finding placements for their students, and the Boys and Girls Club and some of the Parks and Recreation facilities felt better because they were able to accommodate these children who had some behavior issues and not have to just eject them from the program. So there are examples, and I think that if you guys are not seeing in your community where families come and say, these are our needs, and then the community coming together and saying, you know, this is how we meet the needs of family, I think we need to be pushing the envelope a little bit on that, because to me, those are just one of the ways that we can make sure that we're getting that buy-in, because providers are showing that they hear the families, and families participated as well. I know that families were contributing. They were bringing snacks to these programs, and you know, they were providing transportation for other families. And so it was really, truly a buy-in, I think, from a community level. Anybody have any comments or anything about something like that? Or has anyone else had an experience like that in their community?
Okay, let's go to the next question. I'm looking at the time.
So how many of you on the phone work with a family-run organization? And I know I heard Texas on here and a couple of other states. Can I hear from other people? Do you know if there's a family-run organization in your system of care community? And if so, have you worked with that family-run organization?
There doesn't seem to be a truly family-run organization in our area. There are organizations run by people who are leadership and advocacy champions, and they bring the families afterwards, or bring the families in as part of their central mission. But entirely family-run, I have not seen that.
All right. Well, contact us offline, and we will see if we can connect you to that. We'll give our contact information. That would be great.
Okay.
And
Anyone else? There's other people. Do you have a family-run organization within your community that you could get involved with?
Oops. What happened?
are there any family leaders on the call?
Well, this is Joy Hogan. I'm the director of our family organization in Mississippi, but like I said, I started as a provider, and I would say one reason I feel really honored to be in this position now is back when I was doing work as a provider and a project director with the system of care. I found our local family organization to be a huge resource on some of these things. Like, we found family members didn't necessarily want to come to things if we asked them because they felt a little nervous, but I could call the family organization and we partnered with them, and they would do a lot of outreach. And I now know from this side of the fence, it's much less intimidating to go to something if another family member asks you. And they did all kinds of things, which we've continued to do now as a family organization, like help with job interviews when you're interviewing staff, look over forms, look over policy, just give input in how to set things up in a family-driven way. And it's nice because if it truly is a family-run organization, they're going to have a lot of family members there during the same hours you're working, which can sometimes be a challenge, to help figure out some of these things and how to get past some of these barriers at a local level. Because there may be local barriers that, and as wonderful as the national TA is, that might be better addressed by a local family organization. Like here in Mississippi, you know, we've got a lot of issues around poverty and all the racial disparities and all kinds of things, and that's where an on-the-ground family organization can help a lot on things like this.
Absolutely. Thanks, Joe. I certainly agree. Are there other family organization representatives or people in the community? Do you know if you have a family organization in your community? Well, if you are in a community and you don't know, we would encourage you to contact the National Federation of Families. we do just about have chapters in every state and several communities, but even if they are not Federation chapters, sometimes we know about family-run organizations in different states and communities. And so one of the ways, and I think George spoke to that, is family members engaging other family members has proved to be very successful for many initiatives. So if you want to have that kind of connection, please contact us, because we think that we could probably get you connected into a family organization that could help with that.
Okay, and the last question.
So we were going to ask, how is family buy-in developed? And I think we've had some conversation about that.
Yeah, but what I'm thinking about is, what do family members do to show that they've got buy-in to family-driven? I mean, working with systems of care, I have heard that some family members don't understand the responsibility that comes with family-driven practices. So I guess what the question is here is, how do family members show that they are buying into it, and how can we develop it? Does anyone have any ideas about that?
Is there anyone on the phone who serves in that role in your community as the lead family contact?
I do in Fort Worth.
Okay, and do you feel that other families understand what it means to do family-driven practices? And I know
No.
you saying you had some issues because of early childhood.
I think there are families who do. Our system of care is older than our grant, and
Right.
there have been some really smart, good, advocating parents. Not a lot, but some have been with us since 1999 when the system of care got going. So
Wow.
I think there are those who do. Honestly, I think what we miss out on is people who are providers and also family members.
Yeah, absolutely.
And when it comes to stigma, they will not self-disclose
Right.
often.
And and we hear that a lot, and I think it is because of stigma, and I think that there has been some intended and unintended consequences for people who are in the provider role. And so I think that as a community at large, I think we really need to do something about that. We get that here even on the national level, that people won't self-disclose because of retribution and other things. So I think you're right. I think we really have to work around that. And I think the issue of stigma is for a whole nother day and a whole nother conversation, because it is a real and a very huge barrier. I really think it is, and I'm glad that you brought it up. But I think it's something that we will really need to address, and maybe we should do a lot of technical assistance around that. That's the one thing that I haven't seen people do a lot of technical assistance around, is how do we help system care communities and families being served in those communities, and how do we help providers and professionals to be able to talk about the issues in their families with mental illness. So I think you're right, and I appreciate you bringing that up.
I think that's a huge point, and the thing I appreciate most that's come out in this call, because since I've kind of been in both those roles as a provider and now as a family member, I will say it's very hard to self-disclose. And I'll also say that in our system of care community, I didn't really change. I did, but my situation changed. And just to be real honest, I get a lot less respect as a family member than I did when I got to wear my PhD psychologist hat. So it's a very, very real issue.
Right, yeah, exactly. So We will take note of that, and then I will actually take this feedback back to the Technical Assistance Network, because, you know, it may be that we can do some work around that. So I appreciate that coming up. That's been really helpful.
Right. And you need to ask for it, all of you, you know, because, you know, Sandra and I can advocate for it, and, but if you want CA around that stigma or around family participation in your system of care, that needs to come from you, that request. So we're coming to the end, and we have about a minute left. So I just want to make sure that everyone knows when the next calls are, and we did have to change the dates in July and in September from the original first Thursday. So so these are the dates of the upcoming Learning Exchange calls. And I wanted to bring your attention to the call for presentations for the National Federation Conference. And you can find that on our website, www.ffcmh.org. And also to save the date for our conference in November 19th and 20th are the pre-conference days, and the 21st through the 23rd is the general conference. And it's going to be a great one, because it will be celebrating 25 years of the National Federation. And here you see our contact information. If you'd like to call us or email us, please feel free, and we'll do what we can to answer your questions.
We thank everyone for being on our call, and we hope to continue with these calls, and we want more participation. Don't be afraid to speak up. Thanks, everybody, and have a good afternoon.
Thank
Thank you.
Thank you. Bye-bye.